This week, a group of investigators focusing on Barrett's esophagus published in New England Journal a paper regarding the ablation of patients with dysplastic Barrett's esophagus. And the idea is that we're going to burn out the dysplastic or abnormal cells of the Barrett's esophagus, and what we can get to come back is regenerated normal epithelium. And this is quite an exciting issue, and this paper actually showed that in the vast majority of patients we could get normal tissue to come back. And in addition to that, not only could we get normal tissue to come back, but in those patients we could reduce their risk of progression to higher forms of dysplasia or to cancer. So I think that that's an exciting work, and certainly there's going to be further information about this down the road. One thing that I'm impressed about at DDW this year is the proliferation of information on eosinophilic esophagitis, which is a relatively new disease entity that has not been well described before. And I was just walking in the poster hall today and looking at the variety of work, trying to get our hands around what this disease is, how it's going to respond to therapy, who's getting it, and what the long-term outcomes are going to be. So I think that there's a bunch of novel, interesting research around that, and especially the therapeutics of that are going to keep getting better and better.